a crash course for the Nclex that combines examples, strategies, and tips to select the right answer will be incredibly helpful for candidates. Hi everyone, I'm here. Today we are going to talk about everything you need to know in order to pass the Nclex in just under 5 minutes. This is going to be a crash course for Nclex. Make sure if you get value out of this video that you hit the like button below and subscribe so you don't miss any other future videos. The Nclex is a computer-based exam that adjusts to your answers. You'll face 150 questions, and to pass, you need at least 85 right. It's a 5-hour test, usually taken at a testing center. The cool part? Once you answer a question, the computer decides if you get harder or easier ones based on how you did. Nclex exam 2025 includes the following question types: 123, extended multiple response, testing clinical decisions and prioritization, matrix grid, evaluating and analyzing clinical scenarios, drag and drop, assessing clinical judgment and critical thinking, close, testing patient care and decision-making, enhanced hotspot, simulating real-world scenarios and focusing on clinical judgment, case studies, 18 questions across 3 scenarios to evaluate clinical decisions. One of the biggest sections of the Nclex is pharmacology. Make sure you know your medications, especially the ones that end in sartan, which are angiotensin receptor blockers. Know your antibiotics, your hypertensives, your diabetes medications, and your cancer medications. If you do not know a medication, do not guess. If it is a medication you've never heard of, just skip the question and move on. If you have a weak area, make sure you focus on those topics that fall within that weak area. If you're having trouble understanding a concept, don't be afraid to reach out to your instructor or do additional research on your own accord. Some of the topics you want to focus on include infection, prevention and control, pharmacology, nutrition, safety, and emergency care. Let's go over some example questions. A patient presents to the emergency room with chest pain. The nurse suspects the patient is having a myocardial infarction. Which of the following medications would the nurse anticipate administering? Fentanyl, morphine, albuterol, or metoprolol? The correct answer is morphine. A patient is admitted to the hospital with a new diagnosis of pneumonia. The nurse knows that the most common type of pneumonia is community-acquired pneumonia. Which of the following bacteria is the most common cause of community-acquired pneumonia? Streptococcus pneumonia. A patient is admitted to the hospital with a wound vac. Which of the following nursing diagnoses is the priority nursing diagnosis? Risk of infection. One of the best components of UWorld is the ebook component. You can download the ebook to your phone or tablet and use it to review while you read on the go. Finally, after you finish all of your studying, make sure you go through and do one final review. Take notes on the things that you missed and try to figure out why you missed them. Do a mock exam if possible. This will help you to determine how well you really know the material. I hope this video has helped you out. If it has, please make sure you hit that like button below and subscribe so you don't miss any other videos. I'll see you next time.